you see any of that coming down in 2017?
There is one state senator in particular who's blocked anything to do with the opioid database under a civil liberties perspective. He's actually a physician. He goes counter to the
Oh, really?
physician community.
Who are you speaking of?
Rob Schaff is his
Okay.
name. Been very active in healthcare issues, and he sees it as a civil liberties issue, that this is data that the government has, and we don't trust the government, therefore we should block it. But yet 49 states have done it, which leaves us an outlier and kind of vulnerable.
Yeah, it is, and it seems like it's had kind of across the aisle support.
It has.
It's real odd that, especially with all of our problems with drugs in Missouri,
Right.
that
And,
we
yeah,
want to address it.
And we see it in healthcare particularly because our hospitals are filled with patients that have addiction, mental illness, and medical problems all together. And very difficult cases to treat. And as soon as you treat them and release them, they're back on the streets and they're back in, and they don't have jobs, they can't keep a job, and so they lead toward crime, and then we see them back cycling in, and so it's really challenging. It's one of the fundamental underlying problems, and I think in our community right now is the opioid addiction.
I mean, I guess that's where nonprofits can step in the interim.
Yeah, well, and there's initiatives statewide. Kansas City and St. Louis both have initiatives to create their own opioid database.
Okay.
It's a fallback measure, but the reality is that puts more pressure on the rest of the state that doesn't have one. So let's say Kansas City and St. Louis and Columbia create one, and Southwest Missouri doesn't. We become the magnet toward people trying to get more access to those drugs, and so, it needs a statewide policy, and we're not going to have it probably.
Do you see that? I mean, it doesn't sound like you see that in 2017, but do you see that at all?
I do, probably in about 2 years.
Okay.
And it has to do with term limits, and certain people are blocking it.
Yeah. Yeah. What about healthcare insurance? I mean, we're hearing about rates going up. Is that across the board?
Yeah.
Rates are going up?
Well, what we're seeing, we're seeing commercial rates go up some, depending on their exposure, 3 to 9%. But what we're seeing most are those people that are mandated that don't qualify for the subsidized exchange, but they're mandated, so they make a little bit more than the exchange subsidy would allow. We're seeing their rates skyrocket. And why is that? Because the insurance companies have to take on the risk for a whole population, and they can't adjust their fees very much. So they've disrupted the natural economics of health insurance, and so the result is higher prices. Insurance, commercial carriers are consolidating, and as they consolidate, they get more leverage. And with more leverage and more power in the market, they can raise rates, and so that's a factor as well that we're seeing.
Do you see anything with Trump's policies and all of the, I mean, pretty much Republican-led Missouri and U.S. at this point? I mean, do you see that changing as far as with the cost shifting to the states, as you were talking about before?
Yeah.
I mean, is that going to?
It's unclear to me
Yeah.
right now. We'll have to see, and I think Trump's cabinet's just forming. We only know kind of their opinions individually, but as they form that cabinet, they may have more aligned direction. We kind of need to wait and see, but I wish I was a little bit more optimistic, but I'm not real optimistic just yet.